Hello and welcome to Finance Conversations. This is the 73rd episode of the Merging Life and Money Show, and I am delighted to be here today. With me today, I have Eric Dudley. Eric is a regular contributor to the show, and we will be talking about Medicare. So before we get going, for those of you who do not know me, I am your host, Marie-Jo César. I help professional women bridge the gap between life and money by teaching them the relevant financial skills and knowledge they need to take control of their money, manage their finances, and understand that they can live their best life with the money they have. Thank you for joining in today. If you are watching the replay, make sure to type #replay in the chat and leave me some comments and questions. Welcome, welcome, and welcome. I come to you live every Thursday at 5 p.m. Pacific Standard Time to share valuable information about how to achieve financial wellness and live your life with means and meaning. So today, I will be talking to, I guess, my older audience, my older niche, and since I will be addressing, along with Eric here, the topic of Medicare. So just like student loan, do not wait to be at the door of needing it to start looking into it. So my special guest, Eric Dudley, as I said, a frequent contributor to this show, will talk to us about this essential service that all of us will need to investigate at some point in our life. So first, let me introduce Eric, for those of you who have not met him. Eric is an independent, experienced, holistic financial advisor. And his specialties are retirement planning, investing solutions, and life insurance. Eric is also the founder and president of Dudley Financial Group. And one of his main goals and objectives is to help his client build their best tomorrow by protecting them today. So welcome, Eric, to the Merging Life and Money Show, and welcome, followers and listeners. Thank you for joining in today. So grab a pen and a notebook, as you might want to take some notes. And I'm saying that you might want to take some notes. It may not affect you right now, but you would want to know what it takes to get prepared on the healthcare side when it comes to insurance. And you may have some parents or friends who are nearing the age of 65 and who might need some assistance in finding out how to go about it. Okay, so remember that the main objective of the Merging Life and Money Show is to share values that could benefit others. Okay, and if you have any question whatsoever, make sure to put them in the chat. All right, so today's conversation, as I mentioned, will revolve around Medicare. Eric will first define Medicare, okay, then he will explain what it covers and what it doesn't cover. And lastly, he will actually get into the weed and look at what plan is actually right for you. So I will just say that Medicare is a health insurance program for people 65 of age or older. Also for people who are under 65 but have certain disabilities. And lastly, for people of any age with an end-stage renal disease, commonly known as ESRD. So Medicare was implemented nearly 60 years ago, and it's quite a technical subject. So Eric, over to you to do your thing. My first question to you is, what is Medicare and what does it entail?
Well, hey, thanks for having me on again, MJ. Medicare is a complicated subject. The government is all about keeping things simple for everybody to understand, right?
Yep.
No, 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 no. They like complicated.
They
They're
would
big
want
into
us to believe that, right?
That's right. We would like to believe that. No. Well, Medicare is as complicated as you can possibly imagine, just like the tax code and stuff. So, but I'm going to try and make it simple, and we're just going to kind of learn these things for educational reasons. And people need to understand what Medicare is and some of the basics, so that you can have a conversation with somebody about it. Okay, Medicare is important to know because whenever you get to a point where you're going to be using it at retirement age, you might be in a situation like a lot of people are, where they're counting their nickels and dimes every day. They might have a fixed income, and they might be worried about, are they going to have enough money to live through their retirement. Of course, healthcare is going to be a major cost in retirement because people get more sick as they get older. So you got to make sure that you are doing what you should do to save money, but yet to still have the coverage you need so that you can be healthy. Okay, so understanding Medicare is important. So there's different parts of Medicare. So the first part of Medicare, first two parts of Medicare, I should say, parts A and B, that is what is called original Medicare. That's the part that was first instituted in 1966. Part A is the hospital insurance, so it will pay the hospital bill. And Part B is the provider insurance. It's going to cover the doctor's bills. Okay, so those two together are called original Medicare. Now, Part A is free. It just, as long as you meet citizenship requirements, you're going to get Part A for free. Now, Part B actually does cost something. It's about $170 a month. And it normally, the Medicare is usually taken out of people's Social Security checks if they are already taking Social Security at the time. Medicare Part B does have a changing, how much they pay according to how much you make. So if a person filing individually and making $91,000 or less a year would pay $170 a month. However, if a person filing individually makes more than $91,000 a year, but less than $114,000, it goes up to $238 a month. And as you can see on this chart, it can go pretty high. If a person who was filing individually made between $170,000 and $500,000, they would go all the way up to $544 a month. It goes up quite a bit. Now, of course, that changes if you're filing jointly, as you can see in the second column there. The numbers change, but the reason why I wanted to show this chart is just to let you know that the numbers do change if you make more money. So you have to understand that $170 a month is the starting rate. It will go up if you make more. And there's also a $233 a month fee or deductible. I'm sorry, not $233 a month, but $233 per year deductible for Part B also. So again, that's just another fee you have to kind of make sure that you understand. Okay, so those are the two parts of Part A and Part B, the original Medicare, that I wanted to go over. Now, in 1997, the Congress wanted to address what they called the donut holes. Okay, the donut hole in Medicare, original Medicare, was causing a lot of people stress. There was a lot of things not covered by original Medicare that they wanted to make sure was covered. So they instituted what is called Part C, or Medicare Advantage. And it started in 1997. And what they've done is they've worked with private companies. So this is private companies that are working with the government to give the people who want Part C HMOs and PPOs. Now, an HMO plan is a plan where you have your own set of doctors, a
Can I,
network of doctors. Yes.
Eric,
Mhm.
can I ask you to explain what HMO stands for and what PPO stands for those who are not insurance savvy, if you can?
You know, I tell you what, you've just done. You just totally, HMO. Oh my gosh, I'm having a total mind blank. All
Okay,
I
but
know is the
you don't need
definition
to
of it.
say exactly, but what does it represent? I mean,
Yeah.
when you have an HMO plan, what does it do? When you have a PPO plan, what does it do?
Right. An HMO
Mhm.
plan is where you have a network of doctors, and that is your doctors that you are going to work with. Okay, you're saying that you're not going to work with anybody outside of the network, and
Mhm.
your coverage will will only cover those doctors. Okay, it will not cover outside of the network. So if you went to a doctor outside of the network, your plan doesn't cover it. You'd have to pay the full medical bill.
Right,
Now,
so
if you go to a
HMO, they are in network.
right,
Yeah.
right, right. Now they're cheaper, but
Mhm.
that's the reason why some people like them. And if a person doesn't travel around very much and a person is set with their, they want their doctor, they don't want anybody else,
Mhm. Mhm.
then an HMO plan might be suitable for them. A
Right.
PPO plan, on the other hand, is a plan that's similar to an HMO plan, but allows you to go outside of the network that you have and just pay a slightly higher payments sometimes a higher co-payment, sometimes a little more and outside of the bill that would be paid by the plan C. But but it does allow you to go outside of the network and actually get coverage and pays for it. So a PPO is a little more flexible, a little bit more expensive. An HMO plan
Mhm.
is very strict, and you can only go to those specific doctors. But anyway, a Medicare Advantage plan also pays for a lot of other things in addition. It covers the donut hole, but I'm going to cover that in a little while. Okay.
Mhm.
Part D happened under George W. Bush in 2006. It's the prescription drug plan. At the time, people were really alarmed. People, especially diabetes, was really starting to become an epidemic in America, and the medicine for diabetes was getting very expensive. And so, because of that, they wanted to have prescription drugs covered under Medicare, which it wasn't before. So they started having a prescription drug plan. You can get this is again, it's a private companies that are working with the government to provide this, and it can be a standalone plan. You can just get Part D, or you can get it as a part of Medicare Advantage, which is Part C. Okay, so either way, either or, you can't do both. Okay,
So
so
tell me something before you go any further.
mhm,
They have those commercial on TV talking about Part C.
mhm.
So to put it in context, um, what does it mean exactly? They tell you that it's not in every zip code, and but you got to call and make sure that you could have it and you could save some money or whatever it is. So since we're talking about Medicare, it would be good because some people may not know, may not understand what it means.
It
Mm.
is that is a great question, and I got to tell you, in order for us to go into the intricacies of Part C, we would need hours. Okay, it really is extremely complicated. But what happens is every single place in the country, according to your zip code, has a different price and different benefits for everything that you're getting. Okay,
Mhm.
now there are so many opportunities with Part C in certain places. Okay, like for instance, Los Angeles might have much more benefits than you might have in a place that's much smaller with a lot less providers, because it has to do with the providers in the area being willing to contract with the government to be able to provide certain things at certain prices, and so if you have a whole lot of providers in the area, you can wind up with really great benefits offered in that area. On the other hand, if you're in a smaller town, you may not be able to get as much, but you won't know until you actually talk to somebody who understands the area and that specific zip code.
Right.
Also, there's different companies. So you have major ones like Humana, for instance. Okay, Humana's big into Medicare Advantage. They might offer something that another company may not, or vice versa. Okay, so it's good to price shop, be able to look around to different companies, different agents, make sure that they're talking about your zip code and not another one. And because, of course, that's going to completely change the game if you're looking at something outside of that. So Medicare Advantage has got to be looked at individually with each area in mind to be able to find out what they can actually do for you.
Yeah, I'm glad that you brought that up because, as I said, every day you see it 55 times on the TV. Yeah. And some people may not understand what it is. Yeah. And some people may decide, okay, well, I don't understand what it is, so I'm not going to look into it. And they find themselves paying to the nose for a thing that, they could have been eligible for if only they knew. So that's why, I do those kind of shows to educate people so they are better prepared, when the time comes. Thanks for clarifying that commercial about Part C of the Medicare plan.
Oh, well, we're going to talk about it even more in a little bit. So. But yeah, go ahead and pull up the this first slide for the Medigap, because I want to talk about that. Medigap is also called Medicare Supplemental Insurance. And it was something that was introduced along with whenever original Medicare started. Again, there was a lot of people that were saying there was a lot of shortfalls to original Medicare. So they wanted to make sure that Medicare that had some supplemental things, which that's what Medigap does. Okay, it is again, it's private companies, and you can't have it with Part C. You can't have Medicare Advantage and a Medigap plan. You can only have either Advantage or Medigap. You can't have both. Okay, but it works along with original Medicare Part A and B, and it's going to cover a bunch of things. Actually, can you show the other slide first?
Which one?
The one that has all the plans, all the different plans.
This one?
There you go. That's it. Okay. Yeah, as you can see, there's 10 plans that you can look at, and each one of them here, it talks about what it covers. It covers good co-insurance for Part A, or it covers the co-insurance or co-payment for Part B. It goes down, blood, hospice care, all sorts of things. And so what a person would need to do if they wanted to look at is a Medigap plan something that's suitable for them?
Oh my God, I didn't even realize that the blood had a limit. Yeah. First 3 pints.
That's right. You need more than that. I guess you're just out of luck. But that's what it'll cover 100% of it, for instance. But even some of those aren't covered. Like, for instance, the Plan K and Plan L there only covers 50 or 75% of the cost for the blood. Okay. And so that's what it's talking about there. So the most popular of these plans for most people are plans C, F, and G. They're very comprehensive. Most people who want a Medigap plan want a very comprehensive plan. Medigap does a couple of things for people. Medigap plans cover people who don't want to be thinking, oh, what if I have major hospital or doctor's costs in the future? I want to make sure I'm paying, right now, so that I'll never have a big swing in health cost. Okay, so they're going to pay a good bit for a supplemental plan here. Okay, and they're going to pay a good bit for other plans that actually help out with this plan too, like dental and vision. I'll go into that in a minute, but it's going to cost you now. But they're saying, hey, in the future, whenever I do have a health emergency, it's going to be covered, and I'm not going to pay hardly anything above what I'm normally paying. So you have a very stable rate of health insurance cost. Okay, and like I said, there are some plans that don't cover very much, like Part A or Plan B, Plan A and Plan B here, but most people don't go with those. Most people.
So I was about to say, why would someone pick any of those plans?
Well, I think that they just wanted to offer it just in case people want it, but it's not very, very popular. Right. C, F, and G are very popular because it is very comprehensive.
Right.
So let's go to the next slide.
I have a quick question for you. So you mentioned Part D, right? So the Part D, really, that's a prescription.
Okay.
cover.
Okay, now this is confusing. Okay. All right. These are plans and these are letters. Okay. And I
Okay.
actually messed up a minute ago too. The other ones are part and whatever. So whenever you say part A, B, C, and D, those are Medicare parts. Okay. These are plans of Medigap. I know it's amazing that they actually named them the same,
Same,
because
yeah.
that gets confusing, doesn't it?
So you could have a plan C with a part D, which is D for prescription.
Yeah.
Yeah.
Like I said, it gets confusing.
Yeah. But can you imagine? I mean, talking to up to people not that 65-year-old and older do not comprehend, but it's something again, and I'm insisting upon that because you got to deal with that and understand it before you get to that door.
Right.
Because when you are there, I mean, A, B, C, D, I mean, all the letters of the alphabet. One is plan, one is a part, and if you don't, at the end of the, you work all your life, and and then you have to have another degree to understand your healthcare coverage.
It is like I said. When I first I have I have a health license, okay, and I've actually sold these before, but
Uh-huh.
I don't do it right now. But the thing is, it is amazing to me that they would actually name them the same thing. I mean, there's an A, B, C, and D here, and there's a part A, B, and C.
Right.
D. It's just
Mhm.
crazy and confusing, but oh well. I guess I shouldn't question
Well,
the
at least, at
government
least, at
here.
least, at least by saying that,
Yeah.
people would pay attention and say, okay, I have a plan, and there are parts to those plans,
Right. And
right?
one thing that's
So,
interesting about it is that like for instance, the Medigap is not going to cover any prescription drugs. So it doesn't cover Part D. Okay.
right.
There is no Part D to this. There's only Plan D, which covers these percentages of all the stuff that you see. Okay. It covers the health insurance for Part A or co-insurance, co-insurance
Yeah.
for Part. Yeah, anyway,
And
it
that's
just
why I asked
doesn't
the question,
confuse.
because again, I can't help it but to refer to that commercial on TV, okay, that talks about Plan C, right?
Yeah.
So, not to be confused,
Yeah.
because Plan C does not have prescription drugs,
Okay. Part C.
right?
Part C does. Part C does have that, but
Okay, yeah, yeah, I thought I understood it. I still haven't gotten it. No, so Part C, which is a medical advantage plan,
that's right.
right?
Yes.
So also offer prescriptions.
Yes, you can get
Okay,
prescription drugs on that, which is
okay,
Part D, by the way. So Part C can include Part D, but doesn't always.
okay. So
Everybody got that?
right, okay.
Who's on first?
So which leads me to the next question in this part and plans. So what is the uniqueness of having Part D then?
Okay, well, that's a good question. Okay, so suppose a person just wanted to have original Medicare. Okay, they just said, I just want original Medicare, A and B, but they also wanted to be able to have prescription drug cover. They can do that. They can just get an
Okay,
individual
so
Part D.
basically, it's, sorry to cut you, it's Plan A and B with Part D.
Yes, you could do that.
Okay.
Or if you wanted to, you could have a Medigap plan, which means that you have Part A and Part B, original Medicare. Then you get Medigap to help cover extra cost for Medicare. Okay. And then you get a Part D plan in addition to that to help cover the drug cost. The reason why they would do that is because if you only got original Medicare, there is no cost maximum allowed amount that is with Part A and B. In other words, let's just say, for instance, you've paid your deductible and you're now getting, let's say, 50% being paid or 75% paid from Medicare, but 25% is coming out of your pocket. Okay, if that's the case, what if you have a hospital bill of $100,000?
Right.
So you're on the hook for $25,000. There is no max out of pocket for Part A and B. Okay. And that's the reason why you get a Medigap plan, because the Medigap plan would cover that completely. Okay. I mean, especially if you get a comprehensive one, they cover it completely. On the other hand, if you get a Medicare Advantage plan, a Part C, they have a lot of coverage. They cover quite a bit of it, but they also have a max out of pocket. Okay. And that can be worked out according to where you live, what company you get, and all of this. And sometimes it's between $2,500 a year and $7,000 a year. It depends upon where you live again in the plan. But
I mean, we
at
talking
least you'll
about
have an idea that you'll have a max out of pocket.
We are talking about significant amount of money.
Sure.
So
Yeah,
that's why it's important to plan about it.
A person who just gets Part A and B is really susceptible to a huge hospital bill if they don't have something to go along with it, because it can, just one cancer diagnosis, I mean, all of a sudden you've got possible surgeries, chemotherapies, a lot of prescription drugs. If you don't have something that's going to help, supplement the, Medicare, the Part A and B, the original Medicare, then you could wind up with some real, medical bills that you don't want to have. And so that's the reason why the government in 1997 came up with Part C, which is Medicare Advantage. And of course, the government had already come up with the Medigap plans, which supplement all of these, the original Medicare, and help to cover these donut holes. Okay, these holes where people were getting
they were
going bankrupt.
Yeah, hence the donut hole concept.
Yes.
Yeah. Okay.
And this next slide,
I can tell you, you need a degree to understand your healthcare cover.
Yeah, it's good to know, because I mean, it can really save people from bankruptcy. Medicare or medical bills is one of the highest reasons for people going bankrupt, especially when they're older. So making sure you have this some type of coverage that's going to keep you, so that you're not liable for all this is important. If you could go to the next slide, I do want people to understand that Medigap plans, while they can be very secure, okay, and they are very secure to an extent as far as, if you have a really bad diagnosis or have an emergency surgery, they will pay almost all of your bill, okay, many times, and depending upon how much coverage you get, how comprehensive it is. Right. But they're also expensive. I mean, this is just an average plan of Plan F and Plan G. I just wanted to show, these are monthly costs. And that's in addition to the $170 a month cost that you're also going to be paying for your Part B, which, that's per person too. So if there's a husband and a wife, you've got $170 times 2, and then you've got this times 2. All of a sudden you're paying quite a bit just for that. And then you still have not paid for your dental, your vision, or your hearing, or your prescription drug. Okay. So it can be pricey. Yep. To have that type of peace of mind, it can be pricey.
Indeed. And again, I would never stop saying it, planning.
Yeah. Yeah. But it's all about suitability. I mean, if it's worth it to you to pay that, and you say to yourself, well, what if I have this happen or that happen, disease, emergency surgeries.
And you know what? Peace of mind doesn't have a price, because you really don't know, how you're going to be affected, or with diseases as you grow older, right? You have the wear and tear of the body.
Yeah.
And anything that you never had when you were young could start happening to you when you get older.
Exactly. And also the Medigap plans here, you don't have a PPO or an HMO. You don't have to worry about, are you in network, out of network? You can travel anywhere. You could be in Australia and use your plans. Okay. You could be wherever and use your plan. You could be wherever you want to be and use your plans, and they'll cover it, all the way up to whatever the limits, according to what type of plan you sign up for. So, I mean, it is very comprehensive, and it's all about peace of mind, and can you afford it?
Yep. That's, it's important to mention it, because then what kind of plan you have to make, because if you plan to travel the world, when you retire, you got to make sure that you have the proper um, health cover suitable for that, because you can't just have the enough for the ticket and the accommodation, and having a good time wherever you're going to be, because things happen.
Yeah.
And you don't want to deplete all your savings either, if you were to get sick.
Right. Exactly. Okay. Hey, well, let's
Okay, let's carry on. So which I guess my next question was going to be, what does it cover or not cover? But you have touched on all of those. So,
somewhat. It doesn't cover long-term care.
Okay.
It won't cover services that help you perform basic tasks, whether through a caregiver or a stay in a nursing home, are generally not covered by these products. It doesn't cover hearing aids. It doesn't cover dental care. It doesn't cover eyeglasses. Now, it will cover cataract surgery in a lot of cases. And it doesn't cover also medical services that are like cosmetic surgeries or corn removals. And it doesn't help you with travel between appointments. And these are some things that actually are covered in some cases. The hearing, the dental, the vision, the Part D are in many cases covered by Medicare Advantage. Okay. Medicare Advantage is extremely affordable in most cases, and will actually help you with all of those, the hearing, the dental, the vision, and the Part D, and give you coverage, and the max out of pocket, which is so important to cover that Medicare, the original Medicare, doesn't have. And so Part C is a very affordable alternative, although it's not as comprehensive as Medigap, but it's not as expensive either.
Right.
And then also Part C Medicare Advantage also sometimes will even reimburse all or part of your Part B payments every month. So like I was saying before, it starts off at $170 a month. There are some Medicare Advantage plans that will actually give you some of that money back.
Oh, okay.
Yeah.
So that's again back to my little commercial that I hear several times a day, and they were talking about getting some money added to their Social Security. Is that what they refer to?
Yeah, that's right. Joe Namath. Was it Joe Namath that was on the commercial?
Yeah.
Yeah, I know. They're getting all the quarterbacks. Well, yeah, and that's exactly right. That's what he's talking about with the Give Back program.
Right. Okay. So, again, thank you so much. So just to look at this covered and not covered, it's you got to make the difference between a HMO and PPO when it comes to the in-network versus anywhere outside the network. And regardless of what it is, Medicare, so that I understand it clearly, does not cover everything. So long-term care is one of it, hearing aids as well as dental care, eye care, I guess, eye glasses and stuff like that. Certain, you said, cataract surgeries are covered. However, the purchase of your appliances are not, right? And so that those are things that people need to know, because well, I can't take my case for I wore glasses most of my life. So, but for those, who, particularly now in the technological age, everybody's in front of a screen, which means that your eyesight would eventually will suffer from that. So, it's important. And hearing aid, and I mean, you tend to lose your hearing as you grow older, I guess, wear and tear, right? And don't talk about the teeth. Okay.
Right.
So, and that's important. You need them to eat, right? So so that's important to know. That's not, all these ancillary services are not covered under Medicare. Okay. And as you mentioned, if you need some long-term care, that's not covered, and that's important as you grow older. So I will urge my audience, particularly the younger one with aging parents, to make sure to have that conversation with your parents before they turn 65. Okay, so they could make the necessary financial arrangement, and look at their savings, because that will be needed to cover that extra premium if you want to have access to certain things. Okay.
Yep.
So which lead me to my last question to you. So how does one know what plan best suits them?
Well, I think it really comes down to what type of person you are, as far as do you need a lot of peace of mind? Are you a person who, just has faith that everything's going to work itself out and you're not worried too much? Or are you a worrier? Are you concerned about things all the time, just keep you up at night worrying? So obviously that would make a difference in what is suitable for you. Also, it makes a difference as to how much you're willing to pay for that. And it also has to do with how healthy you are. I mean, whenever you turn 65, if you're in fabulous shape and you're running a whole bunch and don't have a history of a lot of bad health things in your family, then that'll make a difference as to which one is the best one for you too. But the main thing to think about is, and this is something we've covered many times, and me and MJ have talked about, is planning ahead. You don't want to get in the middle of a bad situation and have not thought about it. Whenever you get to 65, you want to have already had plenty of conversations with experts about, which is the best plan for you. What is the best plan in your area where you live? Is it suitable for you? Because do you travel a lot? Are you possibly going to need to see different doctors in different areas of the country for whatever? Do you have the money for it? Do you have a health savings account, which is a good thing to be thinking about too, so that you'll have money just in case? And also, do you have long-term care insurance? Because we did not talk about that whenever I said, Part C covers the dental, vision, the hearing, and also the prescription drug, but it doesn't cover the long-term care. So making sure that you get that in order is something to think about too.
Yeah, and that is the one thing that we addressed. I can't remember which show it was, but we did have a show on long-term care as well. Probably last year. Yeah, it was one of the very probably first show that we did together. So yes, so let me show my face talking in behind you here. Yeah, so that is very, very, very important. So it will depend on how much cover you desire, how much peace of mind you want. And of course, we do say that peace of mind doesn't have a price, but you got to put the money aside in order to pay for that peace of mind.
Yep.
And that's not an overnight situation. That is an overtime situation.
Yeah,
as always. Okay, so what else do you have to tell us? Based on your experience, one question that I would have for you would be, what are the most common problems with Medicare that you've known about?
Well, I think when people haven't considered the max out of pocket question, you've really got to make sure that you cover yourself so you don't have a bankruptcy problem that is caused by a medical issue. You want to be, honestly, you want to be on something that's more than just Medicare Advantage or Medicare A and B, the original. You want to have something else with it, either it's Advantage or the Medigap, because by covering that max out of pocket, you can definitely save yourself from losing everything you have, really.
Right. And I believe also that people seeking Medicare, there is a deadline, there is an age period that they have to start looking at it or register for it. Can you enlighten us a little bit about that?
Well, when you first turn 65, you're allowed to get onto the Medigap insurance without any health screening. But if you wait too long, then you're going to be subject to health screening. So then they'll, of course, reject you if you
So
have health problems.
pre-existing condition and stuff like that would
Right.
matter.
Right. And
Right.
so that's the reason why making sure that, you start looking into this before you even turn 65 so that you can make sure that you hit all the windows just right and you're going to be
Mm.
covered. And also, whenever you are about to, you can actually get onto your Medicare coverage, within a few months of turning 65. So you don't have to
Right.
wait.
That's what I was
Actually,
about to say, because for some reason, still looking at those Medicare commercial and stuff, and we're saying you got so many months to do something
and
that
and
relates to Medicare.
the good news is that when you turn 64, you're going to be very popular on the phone. People are going to be calling you 100 times every week. Okay. And lots and lots of people will want to talk to you about Medicare stuff. So
So basically, you do have to register and select your plan and your parts before you actually turn 65.
well, you don't have to. I mean, like for instance, let's just say you're working still.
Uh-huh.
Okay. And you're
No, I
getting
mean, assuming that you are off the
Mhm.
clock.
Right,
Yeah.
exactly.
Mhm.
So if you've already retired, and really the best thing, unless you just want to pay for private insurance, which is crazy,
Right.
it would be much better to go ahead and take your Medicare then. And yes, you should start looking into it whenever you're 64 and a half and make your decision by the time as early as you can to get on whatever plan you want. Because if you make the right plan, you'll have peace of mind, but you're also liable to save a lot of money too.
Right. So can people actually have a kind of a hybrid situation, part Medicare, part private um,
Well,
health insurance?
that's what you would be doing if you decided that you wanted to have a Medigap plan. That is
Right.
a Medigap plan would be a private plan,
Right, private plan,
and
right.
of course you would get a private insurance with your prescription drug and your
Mhm.
hearing, your
Right.
vision. So yeah, you can, um, and of course then having it the bulk of your medical coverage being from original Medicare, that would
Right.
be a good thing too.
Good. And again, I'm asking those questions because of the planning. You don't want to be sick and try to figure out, okay, what is my coverage? What am I entitled to? How much money am likely to put out? And you're talking about astronomical hospital bill potentially. A day in hospital is quite expensive these days, right? And I mean, I was just looking at your chart. I mean, 3 pints of blood. That's all they cover. So, I mean, you don't know what could potentially happen if you need a surgery or anything like that. I don't think that 3 pints will go far. So, so I guess when it comes to lab work and stuff like that, 3 pints might just do it. But it's we're laughing about it, but it's a serious matter. So again, thank you so much, Eric, for this very, very, very how to say, comprehensive and informative presentation today. And so let me just recap uh, what you touched on today. So you talked about what is Medicare, and then you look at the various coverage that it offers, the various plan, and lastly, you gave us some clarity about what plan is right for you. So, listeners and followers, that is a very, very important topic. And I'm sure I'll be talking to Eric, and we'll probably dice it and slice it and probably come back with more 30 minutes little session there
Oh,
because
can I say one other thing? I just wanted to, because I hate the fact I had a total mind blank about HMO and PPO. Okay, HMO is a health maintenance organization, and a PPO is a preferred provider
I love it.
organization. So,
Okay.
okay.
Okay, no problem. So I was just saying that it is such an important topic, and it's so many. I mean, right now the boomers are the second largest segment of the population in America. They're slightly overtaken. They have been overtaken slightly by the millennial. So, which means there are millions and millions and millions of people that are either retired over the age of 65 or who are looking at retiring. So we will, I'm sure, not in the distant future, take another look at Medicare and probably do something more specific to a particular plan or part, or even a summary highlight, so that people could really understand what they are likely to face. And again, a lot of major things are not covered. Long-term care, I'm going to say that again, long-term care, hearing aid, aids, also glasses, prescription glasses, and dental care. So it is very important to secure those things from other providers, so that, as Eric said, you don't declare bankruptcy on yourself because of health reasons. Okay, so I will end by saying that Medicare is very important in the United States, because, as we saw today, it provides health care insurance for American age 65 and over, or anyone who qualify for it in America. And it is also the largest health insurance program in the country, covering, the last statistic that I saw, they were talking about almost like 55 millions of people. And I would even say that those millions of people, they otherwise, without Medicare, they would have not been able to afford health care. And as you noted, Eric, it covers a wide range of medical services, and it is also accepted by most doctors and hospitals. Okay, it is, Medicare also helps to keep healthcare costs, I would say, down by providing a way for people to get the care they need without having to pay for it out of their own pocket, which is very important. And lastly, since Medicare was implemented in 1966, I think it was passed in 1965 and implemented in 1966, Medicare has been a very important part of the social safety net in the United States, as it is a larger source of, again, I would say, healthcare funding for low-income Americans. So thank you, Eric, for your awesome contribution to the show today. As I said, we will meet again very soon, regardless of the topic that we're going to address. But we should have a private talk about that and see how we could probably do a Medicare series, period, where we will unearth basic stuff that people should know and should be looking at knowing if they don't know, and particularly those who are heading that way, to know that it is important to have healthcare saving. Okay, so thanks again, Eric, and let me put your information down in the banner for the rest of the show, which is going to be ending very shortly. So if anybody has any question about Medicare, any related question to Medicare, they could reach out to you so you could answer their question. So for more information about how to achieve financial wellness from the inside out and live a purposeful life with the money you have, join me next week, Thursday at 5 p.m. Pacific Standard Time, 6 p.m. Mountain Time, 8 p.m. Eastern Time, and 9 p.m. Atlantic Time for my Bermuda peeps. And also Friday, 10 a.m. Brisbane, Australia time for my Australian friends. Thank you for being here today on the Merging Life and Money Show. I am your host, Marie-Jo César. I will be back again next week. Until then, continue merging life and money. Bye for now.